I am Teresa Pleumer. I am 55 and I'm from Platteville, Wisconsin. I had total knee replacement on my left knee because I was in pain all the time. It held my life back. I couldn't do what I wanted to do at 55 years old. I am not doing what I want to be able to do. I did not have a quality of life and I needed my quality back.
Teresa came and saw me last December and discussed with me her knee pain. She had previously been seen by another surgeon who told her to wait on surgery because of her age. I really believe that knee replacement's a quality of life surgery, and when patients get to the point where they're miserable, I think it's a good decision to proceed with surgery.
My whole surgery was so great. From the first time I met Dr. Lindsey till I walked out the door and said goodbye after the hospital stay, the staff. I am scheduled to have full knee replacement on my right knee on November 14th of 2017. It's no walk in the park, and it's not easy. And there's days you do not want to get up and go to that physical therapy because you know what's going to happen, but every time you go gets a little bit better.
Teresa's second knee replacement went excellent as well, and now it's up to her to push through the recovery and the therapy to get back to the full quality of life that she desires.
The same day as surgery, you're going to have physical therapy. They're going to come into your room and they're going to have you start moving your knee. They will have you up and walking on that leg. You will walk down the hospital corridors with their assistance.
Normally we'll start in the hospital with the first day just trying to get them out of bed. The goals are to continue to improve the strength and get the range of motion back in the knee. Then we will start outpatient therapy within the next 4 to 5 days.
When they release you from the hospital, you will have some exercises that you need to do at home.
Our goal at 1 week and 2 weeks is to make sure that they are having the 90 degrees of range of motion, where we'll have them stretch on the step. We'll assist them with bending the knee while they're laying down on the table. We'll assess how they're walking with the walker and trying to make sure that we get the thigh, the quad muscle to start working, where they'll be pushing down into our hands. Some of the balance where we do some of the standing, where they're going up and down on their toes.
You're going to be swollen, you're going to be sore, and you're not going to want to do the exercises, but the physical therapy department will help you through that.
The next stages would be to start working on balance, getting them more up on their feet, and getting away from using the walker to doing the cane. So we might do some balancing on one leg at a time, work on going up and down the steps, all those activities to try to progress the strengthening from lunges to squats so that we can get them back to more what a functional person would do. As we get closer to 8 to 10 weeks, most people are starting to feel more like themselves. We'll try to be primarily on the cane, and hopefully at the later times they'll be walking without an assistive device, wanting them to be able to get up and down the steps without much difficulty, starting to return to driving, returning to work as long as they're not on their feet for the whole day, getting back to their normal activities.
To manage your pain during physical therapy, you need to take your pain medication at least a half an hour before. You're going to get an ice machine when you leave the hospital. They'll have it hooked up to you. Make sure you use that at home. Make sure it's pumping all the time.
It is not something that is going to go away in a couple days. Long-term recovery is 6 to 12 months, but most people are feeling really good by 10 to 12 weeks.
Recovery is tough, but it's so worth it in the long run that 8 months down the road, I know what I'm going to feel like, and it's going to be a wonderful, wonderful thing. And Dr. Lindsey is the one to thank for that, because he is a remarkable man, and Southwest Health Center, Dr. Lindsey, the staff, they are the best. I'm getting my life back, and you can't put a price on that.